why are some of the community skeptical or hesitant to or about the vaccine? Dr. Lee, can we start with you?
Yes, absolutely. As we all know, the historical context of historical trauma and specifically some of the relationships that we've had with the federal government and our sovereign tribal nations in terms of treaties being broken, mistrust with the federal government and implementing quality healthcare services that were treaty abiding. Actually, as part of our treaties, we agreed to, in exchange for land, to be federally funded for healthcare, housing, and education. And that all three components have not been fully funded, nor do we have the quality of implementation of healthcare services as well. So there's been a long continuum of decades of mistrust as being Native American, and especially within the Indian Health Service care system. And so our tribal members have been very concerned about the dissemination of the vaccine due to the continuance of the mistrust that we currently have experienced. Thank you.
Thank you, Dr. Lee. Roxann?
I will echo some similar sentiments to Dr. Lee. The African American community has a huge distrust of our healthcare system and our federal government because of a lot of experiments that have negatively impacted African Americans. And one notable one that went on for many, many years is the Tuskegee experiment, where they experimented with African American males and syphilis to see how their bodies would respond to that. And they were told that it was something else when they were actually being injected with syphilis. So that, amongst many other tests, have been performed unwillingly on African Americans through our federal government. And so it has just left a huge mistrust in terms of being adequately cared for by our government system when it comes down to making sure that we're getting the best treatment that is available for us out there. So it's been taking place for generations, going back to slavery, when African Americans have been used as test objects negatively by the federal government. And so right now, today, we just don't trust that they have our best interest at heart. And so.
Thank you. Peter?
Yeah, so, you know, for us, for our community, the Hispanic community, it's a little bit of mistrust, but it's a whole lot of misinformation. It's, you know, it's one neighbor telling one person something they read on the internet, that this vaccine has a chip in it and it's going to lead to ICE immigration coming and picking people up. That is real in our community. A lot of people don't get that. It is real in our community and it is every day. Why? Because we've been deported and we've been caged. And so immigration issues is real with us. And so when abuelita, grandma, it even crosses her mind that maybe somebody in the household is maybe here undocumented, she's not going to take that chance. She's not going to take that chance. And so what happens is she shares that with another neighbor, and with today's speed, it's all of a sudden a whole block is not getting vaccinated when they can. And it all leads to from chisme, which is gossip in Spanish, and misinformation. I don't think it's a trust, because all the Latino Hispanics I talk to understand that our healthcare, you know, our medical industry, we have smart folks in the United States doing it right. So the vaccine's not meant to hurt anybody. Pfizer wouldn't do that. And yes, the speed of which it came maybe made a little bit nervous. Some people are nervous, but I'm just telling you, in our community, unfortunately, it's the misinformation and the speed in which it gets into each house.